Do you ever wonder if there's something particular you should be eating for your fertility? Maybe there are things you should avoid. I get lots of questions from patients every day about how they should eat to support their fertility. I'm Dr. Shala Salem, and today I'm going to be discussing the top tips that you need to know about how to support your fertility through nutrition. And if you stick with me to the end, I'm going to let you know where you can get a free gift to help support your fertility further at home. Unfortunately, so much of the fertility journey is unpredictable and can feel out of your control. So I often like to focus on areas that you can control, and one of those areas is nutrition. In my opinion, this is one of the most important things that both women and men can do to support their fertility journey. First, let's talk about the Mediterranean diet. This style of eating has shown to have several benefits when it comes to fertility, including improved ovulation, improved sperm parameters, and higher pregnancy rates. The Mediterranean style of eating has been shown to be beneficial in both men and women trying to conceive. Many of the studies have been done on those who are using in vitro fertilization, and they have demonstrated higher pregnancy rates amongst those who followed a Mediterranean style of eating. The Mediterranean style of eating is high in vegetables, olive oil, fish, nuts, legumes, and low in packaged or processed foods. If you are eating animal protein, aim to get lean animal protein, and I recommend organic or grass-fed and pasture-raised when possible. Vegetables and fruits are a very important part of your diet because they're packed with antioxidants like folate, vitamin C, vitamin E, all which have been shown to be beneficial for fertility. Another key point of the Mediterranean style of eating is getting the right kind of carbohydrates. While carbohydrates like pasta, breads, and sweets are not fertility-promoting foods, it does not mean that you should stop eating carbohydrates altogether. Better carbohydrate options include vegetables, fruits, whole grains like quinoa, wild rice, lentils, and beans. Seafood is one food that has consistently shown to be supportive of fertility. But I often get questions like, well, what about all the mercury in fish? Isn't that bad for fertility? While I do recommend limiting some types of fish because of mercury, there are a lot of great options that can be beneficial. Those who had the greater amounts of omega-3 fatty acids in their diet had a shorter time to pregnancy. One of the other things I like to recommend is eating a very colorful diet. Try to aim for more vegetables of diverse color. The pigments in the fruits and the vegetables are more nutrient dense and are loaded with antioxidants that can be supportive of egg and sperm health. Getting adequate fiber is another area that's very important. Fiber is important because it allows for regular bowel movements, which will help to eliminate toxins and hormones from your body. Eating a fiber-rich diet is important to encourage a healthy gut microbiome. Your microbiome is a group of trillions of bacteria and other organisms that play a huge role in every system in your body. They help to support healthy function. But the microbiome can become overrun with bad bacteria, and that can lead to illness and poor immune function. The health of your microbiome has an important role in mood, immunity, fertility, and so much more. We are only starting to understand all the benefits of a healthy microbiome. Another key tip I tell patients is avoiding processed and packaged foods. I often recommend trying to avoid eating out often. During this time, it might be difficult because you might be ordering out more. However, studies have shown a dramatically increased chance of infertility amongst couples who ate fast food more often. Processed food is associated with poor egg and sperm quality. And the packaged food that comes with fast food often contains high levels of chemicals like BPA, phthalates, and PFAS, all of which have been found to have a negative impact on fertility. Another problem with eating out a lot is there's a lot of simple carbohydrates in them. This would include sodas, sweetened beverages, candies, desserts, white bread, pasta. All of these foods can lead to higher rates of inflammation in the body and are linked to lower fertility. Outside food and processed foods are high in refined oils. These foods can be damaging for fertility because they might be processed with lots of chemicals and are often non-organic. And the last tip I want to tell you about is I recommend to eat organic when it's possible. Eating organic will help to reduce your exposure to pesticides, which are potent endocrine disruptors. That means that it may impair normal hormone function. And did you know that organic fruits and vegetables were found to have higher nutrient density and higher antioxidant levels than those that were exposed to pesticides? This is just another reason that supports eating organic for fertility. Studies have shown that women with the highest levels of pesticides in their urine had lower pregnancy rates. Do you want to learn more about how to support your fertility with proper nutrition? Please check out my free ebook where you can get even more nutrition tips to support your fertility. To get your copy, click the link in my bio.